Hi friends, welcome to Health is Wealth and another Wednesday, another new Wednesday for you. But we still have Dr. Mehrotra who will guide us through our journey. Welcome, Dr. Mehrotra.
Thank you so much, Ragini. It's great to be back again and talking to our viewers once more.
Yes, and we are going to talk about a really critical factor for the kids. And as a pediatrician, you have to focus a lot of light in that section as well.
Well, it's my pleasure, and this topic that we're going to touch on today is not just for kids, it's actually for every single person. So it starts off in childhood, but it goes all the way through senior ages.
Yes, and we are going to talk about immunization. So we see all the babies and the kids to take them to the pediatrician. So when the first immunization starts, and what are the first steps, and what are the things that you follow all the time?
So the job of a pediatrician, the main thing that they focus on is preventive care and making sure that your child is healthy as they grow. So every step of the way, we want them to be as healthy as possible. And immunizations help with that. There are sets of vaccines that are given, and at every single age, there is some vaccine or another that's given to the child to help them stay protected against those illnesses. Now, I know a lot of parents, some of them will be, taking the vaccines. They say, okay, whatever the doctor says, go ahead and do it. But then there's also a lot of parents who want to know more, which is great. We want our parents to be informed. We want them to know what these vaccines are all about. So to be an informed parent is the most critical piece for any parent to be, right? Because you are going to make sure that what we're doing with your child, with your baby, with our, the baby that we're going to be taking care of, to have the best of everything that is currently available. So what we call the best practices. What is the evidence-based medicine? And that is where the series of immunizations that are given to kids, that's where it comes from.
Sometimes you see that who are the new parents, they have a lot of things in their mind and their head that they are worried about the child. And sometimes you also say that, okay, from this vaccination, the baby will get fever or something, this or that can happen. And they easily get so much anxiety out of it. So what is your say in that?
So the first thing for any parent that we need to do is to tell them what the immunizations are all about. What do they cover? I think one of the most common things that parents remember is polio drops, right? So in India, everybody gets polio drops. And the first thing that a child gets when they're born is BCG vaccine. But both of those are not given in our country here in the US. So what is the equivalent? Why is a certain vaccine advised to be given at a certain age? That, what we call policy, comes from a governing body called the ACIP.
Okay.
And that is the Advisory Committee on Immunization Practices.
Okay.
Now it's a federal agency that sits there and reviews all of the science, the literature, what has been happening with the vaccines, looking at all of that, and then they make a recommendation as to what the vaccination schedule should be. What should the dose be? What should the intervals be? And from that is what other governing bodies then might implement. So the ACIP comes out with the recommendations, then the American Academy of Pediatrics, which is the governing body or the body of all the pediatricians in the country, that then says, okay, we endorse that. And that is how that immunization schedule comes into play. So if you've had a kid, you know that you are going to the doctor again and again and again for a certain set schedule to get those vaccines. So that schedule is determined by the ACIP. And I'm sure, I don't know if a lot of people didn't know that. This is information that they should know.
Wow. I mean, of course, for us, we just go to see you, and then mostly whatever you are recommending, we are just looking at that. So before that, all these steps are there.
Right. So all of the science that is looked at by this governing body. Okay, so many people say, oh, why should I give the vaccine? What is this vaccine about? I don't know, but what you have to understand is so much work has gone into this with so many experts sitting around the table to figure out what is it that we should protect our kids against. So we have our schedule that, okay, at birth, the hepatitis B vaccine is given, at 1 month the second dose is given, at 2 months you have vaccines for diphtheria, pertussis, tetanus, you have for Haemophilus influenza meningitis, then you have pneumococcal meningitis, you have rotavirus, and these are names like that you as a parent may not even know if you are not informed. And then if the vaccines are given at 2 months, then they're given again at 4 months, then again at 6 months. So we need to make sure that we as pediatricians go ahead and educate the parents. So one of the biggest things is when you come into the office and we tell you, okay, for today's visit, your baby's 2 months old, these are the 5 vaccines that your child needs. And you may say, oh my God, that's a lot of vaccines. But the reason those vaccines are there is because that was the recommendation that was passed on by the ACIP. And once we give those vaccines, we also have to tell you exactly what that vaccine is about. What are the possible side effects from that vaccine? So we'll tell you, okay, this is something called a VIS, which is the vaccine information sheet. And each of those sheets are then given to the parent, ask them to review it. Okay, if you have any questions, ask me. I'm telling you what this is covering, and then these are the things to watch out for. Now, if you give me consent, I will then go ahead and vaccinate. So that is the process that we follow in the US.
So when you see the new patient or a newborn baby, or if like maybe later on, maybe 4 months or 6 months, you are saying that your child needs 4 or 5 vaccination once, or maybe that one day. Have you ever heard from the parent that why all this together? What is, are they safe or anything like that?
Of course, all the time. And I think any parent should always question what they're being offered, because that is the hallmark of, knowing that what's happening with your child. So the pediatrician needs to educate the parent needs to be educated and question, why am I telling you to do this, this, and this? Okay, so many parents will ask me, why the rotavirus vaccine? My child used to get diarrhea, dehydration, what's going on? Why do I need to give that vaccine? I don't want to give the vaccine. It's my job as the medical provider to educate you and tell you, is this the right step or is it not the right step? And these are the pros and the cons, and you have the final authority. Okay, if you are telling me as a parent that I really don't want to do it, and you don't have a rationale behind it, then I have to question your authority as a parent as well. You have the right to question me, I have the right to question you. So once these vaccines have been implemented, or the recommendation has come out, these are monitored very, very closely. So if there's any sort of an adverse event that happens with the vaccine administration, then that needs to get reported into a centralized agency. There's something called the VAERS, so that's Vaccine Adverse Event Reporting System. So anytime a vaccine, there's a questionable or anything that happens as a side effect of the vaccine, which is not the norm, then as a provider, I have to make sure I report that to this agency, to this system, so that they can keep track of it. Right. A lot of these vaccines have been there for many years. There's new vaccines that keep on coming on the market. But we need to make sure, it doesn't matter how old the vaccine is, we still are monitoring these vaccines and the side effects that happen, so that if there's anything that is wrong, that gets pulled off the market right away. So there is such a tight regulatory system in this country.
So when we are taking vaccines, right? So is it always like 100%? I can say that that we can say that, okay, if you take the vaccine, then you are not going to face the disease at all. Is it some kind of like that, or no? You can have that type of disease, but maybe the effect will be less.
Sure. So the efficacy of a vaccine, how effective is it? no vaccine is going to be 100%. So it depends on how your body's immune response is to that vaccine. So what is a vaccine? Let's actually step back. So vaccine is some sort of a protein. It could be some sort of a derivative. It could be a live virus that is going to elicit a response from the body. So let's say if you have a chickenpox vaccine. The chickenpox vaccine is caused by some sort of a virus. Now, when they actually engineer this vaccine, when they make this vaccine, they have a different strain of the virus, which is then injected into the body. And your body thinks that this is chickenpox and will build up an immune response. So when that body does that, then it holds that memory so that when you actually get exposed to the real chickenpox, then your body will respond and fight that real chickenpox off, so you don't contract the virus itself, and then you don't get the disease. So similarly, there are many different ways of creating a vaccine. So you can have a live virus vaccine, you can have what's called an attenuated vaccine, you can have a engineered vaccine with some sort of a protein derivative, and that then gets injected into the body. And your body then says, okay, well, this is what the real disease is like. So when the real disease actually hits you, the body has a memory, builds up that immune response, and fights that off. That is the purpose of the vaccine. Now, if you're trying to get vaccinated against polio, there's usually 5 doses or 4 doses that are given in the US, and they're given at certain interval. So the first time you get it at 2 months, you might build maybe about a 50% response. So you have that memory. Half of the time you may, fight off the illness, half of the time you may not. You get a second dose. The second dose may build up your memory a little bit more, maybe another 10%. So you might get 60% effectiveness. Then you get a third dose. It builds up a little bit more, and a little bit more like that. So by the time the series is done, you may have, if the body cooperates and if the vaccine is really effective, you might get 60% efficacy, you might get 70% efficacy, you might get 90% efficacy. But really don't see 100% efficacy. So even when you do contract the illness, your symptoms that you get from the illness may be much less, okay? Or you may not get the illness at all. And that is the purpose of vaccines, to build that immune response, build that memory in the body so that it can fight off.
What are the side effects of these vaccines?
So each vaccine has their own host of side effects that they can have. And it doesn't mean that when you take a vaccine that you're actually going to have side effects. So we have what we call local reactions, or you can have something called systemic reactions. So local reactions could be you get a little bit of redness on the area of the injection, you get some swelling, you might get fever. Based on the vaccine, you might get some other local symptoms which are what we call self-limiting, meaning that you get them, 2-3 days you have them, and they're gone. You could have severe reactions. You could have systemic reactions, meaning you can have a severe allergic reaction. Right? The likelihood of that happening is reported to be very, very small. So it's like, you might equate it to peanut allergy. Let's say you take a peanut and you're severely allergic, your body can collapse. Similarly, when you inject some foreign body or foreign item into your body, you can have a severe allergic reaction and you could collapse from it. So, not likely, but it is a possibility. So the more common side effects, so if you actually get into it, would be more of the local side effects, fever, redness, irritability, the kid doesn't eat properly for a couple of days. If you're taking the rotavirus vaccine, you might have a stomach upset for a few days. So these are the type of things that can happen. Then there are even much more serious side effects based on the vaccine that you take. And I think a lot of people, when they talk about it on the internet and they look at it, when they're not able to explain some symptoms or something that may have happened, they may attribute that to the vaccine, which may or may not be true, and we'll talk about that in a subsequent episode. But you have to be aware that these possibilities exist.
What are the seasonal vaccinations?
So, each set of vaccines, there may be a different time for it, or there may not be a different time for it. There may be an age group for it, there may not be an age group for it. So, if you're looking at seasonal vaccines, seasonal vaccines are something like flu, right? That you get that in the season, and that we can dedicate a whole show on that. But everybody knows that, okay, the flu season is coming, let's go ahead and get the flu vaccine, right? Then there are vaccines that are given to seniors, because after a certain age, they're much more predisposed to certain illnesses. So we go ahead and give those vaccines to them. Then there are vaccines that are given to college-age kids, the meningitis vaccines, because that is where they're much more predisposed to it. So when the kids go to college and they're staying in dorms, in closed quarters, or if they're in the military where they're living in barracks where everybody's close by, then that's how the germs get spread. So if you might have heard about this in the news at Rutgers University a few years ago, or in central New Jersey, there was an outbreak of meningitis where some kids actually died from it. And at certain universities where they've had an event like that, it has become mandatory to take certain vaccines, because when the kids are put together in the dorms, in the dormitories, they're sleeping right next to each other. One kid gets it, the next one passes it on, the next one gets it, the third one gets it, and so on. So it becomes extremely critical to know which environment is that child going to be in, and that is how the vaccine is going to help them, or which vaccine is to be given to them. So you have the routine childhood vaccines, the DTaP, polio, the children meningitis, and so on, the rotavirus that they get. Then you have vaccines that are given to middle school kids when they get into that age group. Your tetanus vaccines, your meningitis vaccines. Once again, when they get to be college-age kids, then different vaccines are given again, meningitis vaccines, and at that somewhere in the middle school age to college age kid, we start talking about cancer vaccines, the Gardasil, the HPV vaccine. Then once they are of childbearing age, then you worry about the measles, mumps, rubella, the pertussis vaccines. So that might be given to them at that point. And then when you become to be seniors, the risk of pneumonias, the risk of flu, pertussis, all of this then becomes quite much more prevalent. So those are the vaccines that would be given to them. And then if you're traveling, then there is another set of vaccines which we covered on a different episode. So as I said, there is a whole host of vaccines. There is age-dependent vaccines. There are seasonal vaccines. So if you start getting into this, you start peeling the onion, and there's so much information that needs to be given. And I think this is more of an overview for our viewers, because there is so much information that we could possibly get into. But I think people might get confused as well. But think about it, that all of these vaccines you really need to be aware of, that it's available there for your benefit, for your health. You need to be informed. Your pediatrician needs to have that open dialogue with you to make sure that they tell you what's recommended at that age, what the potential side effects are at that age, and how you can protect your child.
Dr. Mehrotra, you just told us that in US, the kids are not getting the polio vaccine or the BCG vaccinations, but why is that?
So so let's take polio for example here. Okay, so polio is administered in two different forms. One is oral polio, which is a live virus vaccine, and then there's injectable polio. It's given as a shot. So the component that is used to make the vaccine is very different. In India, what we have is what we call herd immunity, meaning there's so many people, and we use the oral vaccine, which then can be excreted into the stool, and as that vaccine then gets transmitted, or as that virus gets transmitted to different people, so as they get exposed to that virus, they automatically get immunity that they build up because of that exposure. In the US, since everything is very tightly regulated, and because of the live virus vaccine, there were some case reports of people developing polio-type illness. In the US, when we are so heavily regulating to make sure that no adverse events happen, we chose in the US to not use the oral polio vaccine. Whereas in India, we see a much more benefit with the oral vaccine, even though the side effects, that potential is there of developing polio, the overall benefit is much, much more. So we use the oral vaccine in India, whereas in the US, we use the injectable. But now in India, we're also starting to see in the cities and some of the larger places, they are using injectable polio. But the overall purpose of the oral polio was to get immunity that becomes second-hand immunity in the community, which is given because that vaccine that's used in India is a live virus vaccine. The other thing we talk about is BCG. BCG is a vaccine that is used to prevent tuberculosis. The efficacy of the BCG vaccine, based on scientific studies, is not that great. And they felt that it may not be effective to incorporate that into the US schedule. So that is one of the reasons why BCG is not used in the US. So we look at what we call the risk versus the benefit. And the benefit was just not enough in the US. But now what we do see is because of all the travel that's going back and forth, a lot of people that are going into India are exposed to tuberculosis. So when they come back, that's one of the things that we have to think about. That's one of the things that we have to worry about when somebody's coming back with, coughing and fever and so on. And we'll discuss this in a subsequent episode as well. But that is one of the main reasons why BCG is not given, because we feel that the tuberculosis is not so, rampant in the US and may not be, the efficacy of the vaccine is not as much. So why vaccinate people when we don't think that the benefit is going to be that great?
Thank you, Dr. Mehrotra, for this interview of vaccination and immunizations. And I do believe that we have to come back, and actually this episode has to be continued next week as well, because we have to discuss a lot more regarding vaccination. So I do believe that this is your final call for our viewers to say a few words to them.
Well, thank you once again, and there is a lot more to cover in our subsequent episode because there's lots of controversies around vaccinations. So today in this episode, we talked about just an overall overview of how vaccines are made, how vaccines are administered, who's the policy-making bodies out there, what you as a parent need to know, what are the potential side effects, and how to get that whole system going and to make sure that you do the best for your child. And there's a lot of information out there on the internet that parents read, and I think we'll be discussing that in a subsequent episode. So thank you very much. And if we didn't get to any of your questions, please do go ahead and email us, right?
Absolutely. You can email us at ragini@manatv.net, and of course inbox us in our episode in Facebook at Mana TV's page. So see you again next week, same time, same day with Dr. Mehrotra. I'll be back again. Until then, good night, stay safe, stay well.